Is anyone else surprised that today, day 11 in the Lindsay Clancy trial, was just as intense as yesterday? Because I know we were all anticipating Dr. Tufts, but I did not anticipate how much involvement Dr. Rebecca Gelada had. Okay, just riddle me this. What's worse, Dr. Tufts, who saw Lindsay over the course of multiple months, 14 different times, and prescribed her multiple medications, and also if she just would have tried a little bit harder, in my opinion, that Lindsay would have been maybe in a different situation. Now, Dr. Rebecca Gelada, before trial, I knew Dr. Gelada's name, but I didn't realize just how short of a time span that she helped Lindsay and how much medication she was tapering off and then adding on. And then she was the only doctor that had thought that Lindsay might actually have bipolar. But what did she do about it? She didn't push for her to get diagnosed or anything like that. She just kind of was throwing medicine at the wall to see what stuck. But I digress. Let's talk about the very start of the day. There was Julie Paul, right? The nurse practitioner, and she was the one that was friends with Lindsay's mother-in-law. And I was surprised to see that Lindsay's defense attorney, Kevin, he did not have much to say. He just said, hey, like, you did the best that you could by basically getting her the right help, or what you thought was the right help, with your clinic that you were leaving, right? And she's like, yes. And so he was like, and you even went as far as to give her your own personal cell phone and talk to her after hours. And she said, yeah. And so he was like, okay, thank you so much for your time. And her face looked so confused. Like, maybe not confused, but just like she was bracing for impact. And she kind of got the opposite. Okay, so now we're on to Rebecca Gelada's testimony. And her main takeaways were that the defense, first of all, was just trying to show that Lindsay's condition was worsening significantly as she had seen her, because she started seeing her mid-November, and then in December, her insomnia, depression, intrusive SI thoughts, the medication problems. I mean, she was like texting through the telehealth app like multiple times in a row until she would then get a response. Now, Dr. Gelada's experience is more significant than Dr. Tufts, because she said that she has treated a total of 5 women that have had postpartum psychosis, some of them hearing audible voices, some not. So just to really quick rewind, Dr. Gelada was the doctor that took over for Julie Paul. So when she first met with her, Lindsay was reporting that she was only sleeping 2 hours at a time and was having intrusive thoughts and would go even 48 hours without sleeping. And when she was asked if she felt tired, Lindsay reported that she didn't, which, if you remember yesterday, Dr. Tufts said that is a sign of mania. If you still have energy, but hardly any sleep. And mania is obviously a sign of bipolar. And that's what Dr. Tufts had thought, but she didn't dig into it as much as this doctor. But yet this doctor didn't actually diagnose her or go somewhere where she could get diagnosed for bipolar, which would in turn make her have completely different medication than what she was continually bumping up. Okay, and these are just all the reports of all the intrusive thoughts that Lindsay reported to this doctor. So on December 2nd, she had intrusive thoughts all day up until 6 p.m. when she caved and took an Ativan. And then it went away. So on December 3rd, she felt deeply depressed with horrible intrusive thoughts. On December 15th, Lindsay and Patrick. So Patrick attended Lindsay's appointment and reported that she was having the worst day yet and persistent intrusive thoughts of self-harm. So then Gelada testified that Lindsay did not have an active plan at that point. So she didn't do anything. She said that actually postpartum self-harming thoughts is quite common in postpartum women. So I'm curious. Okay, but then this is new about Patrick. So Patrick attended a couple of doctor's appointments from that point, and also a few phone calls. And remember when yesterday Dr. Tuff said that she didn't feel as concerned because Lindsay was an adult who could advocate for herself. But at this point, meeting with Dr. Gelada, Patrick was actually speaking for Lindsay. And, on cross-examination, they said, okay, did you know that she even stopped driving? And of course she answered, no, I actually did not know that. And then once again, Kevin followed up with, okay, so when she was checked into the ER, or the program that you had recommended, and then they turned her away in the women and infants program, did you follow up with the doctors? And apparently, I don't know who's lying or if they're going to actually pull phone records. I would be curious, but apparently the program at the Women and Children's Hospital called Dr. Gelada to speak with her so that they could connect. And Dr. Gelada said that she never received that phone call, but a few days later that she recommended Lindsay for the program. So one key point actually of her testimony was that Lindsay was advocating for herself to taper off of the, let's see, what medication? The Seroquel. But Dr. Gelada actually wanted to do the opposite and bump her up more. Now, it's not clear why they stopped meeting, but the last time that she treated Lindsay was mid-December, and that was the last time that she also had prescriptions filled as well. So it almost sounds like the defense attorney is trying to obviously highlight that both of these doctors were negligent in their practices, and how much prescription that they prescribed, but the Commonwealth was trying to basically downplay whoever is on the stand at that time. In this situation, really was saying, okay, but you didn't prescribe this medication and this medication, right? It was Dr. Tufts. But in the span of Dr. Gelada's time, she prescribed her, 8 different medications.